We're live. All right, so I'm just gonna let our Telegram group know that I just went live. That's what I'm gonna do right now. Telegram group. Live on YouTube. If you're coming in, guys, give the video a like. Give the video a like. What are you guys up to? What are you guys doing? Do some Q&A here. What's going on, Sabi? What are you doing, Sabi? What's going on, guys? What's going on? What are you guys up to? What are you guys doing? Sabi, what's going on? Sawa, what's going on, Sawa? What are you guys up to? Med, what are you doing? Med, I don't think I've seen your username here before. You got COVID in here. What's going on, COVID? COVID, you got to think about like a new username because like no one wants to think of like fucking COVID, right? Like why would we want to think? Why are you like still in COVID headspace? You know what I'm saying? You do really well in Japan because like people here are very whiny and complainy and they like to think about COVID still. Like there's people still wearing masks. Guys, give the video a like if you're coming in. Give the video a like if you're coming in. Help boost the algorithm here. I let the Telegram group know that we're here. Saul 8882, good to see you again. Good to see you too, 888. Saul. Jim T. Gibson, yo, what's going on? Yeah, it's called Katakon. Guys, give the video a like if you're coming in here. There's 32 of you here. There's only 10 of you liked it. Yeah, Katakon. I had if you go to like my old fucking YouTube clips, I had like a shitload of like colored contacts in. Some of them were like really fucking creepy too. Like Halloween fucking like contact stuff. But yeah, I just decided to put some in. Philip Radunovic. Hey, bro. What's going on, Philip? I don't think I've seen you in the chat before. I think it's like first time I've seen you here. The Medical Jetty. What's going on? Studying for the IM shelf. What are you guys up to? Judson. Hello, sir. Good to see you. Big fan of you, sir. Good. Thanks, Judson. I don't know if I've seen you here, Judson. First time. Michael Betamariam. Yo, what's going on, dude? Good to see you again as well. Guanacho. Montillo. Well, are you wearing lenses? It's too cool. Yeah. As I just fucking said, like I have lenses. I have like other lenses too I could put in that are like, I have like Halloween fucking creepy fucking, like even more creepy that I could put in if I really want to go that route. Right? I already get people criticizing my appearance. So then you add like weird fucking contact lenses on top of it. That'll right? Just let's add fodder. Anas. Hi, what's going on, Anas? Mimi Lele, is that your fucking name? Hello, dear Mike, what's going on? Anas, 69%. Here we go. First med question, right? Guys, drop med questions. Give the video a like here. Anas, 69% or a 208, MME 25, safe to sit the exam. Excellent score. I've said I want at least 3 exams that are a 205, 210 plus. That's what I want to see. Okay, so that's perfect. But you got to sit more NBMEs. We need more data points. You know what I'm saying? You got to back it up and you get like at least 3 exams that are 205, 210 plus equivalent. We're good. SARS-CoV says, I'm just too lazy to change it. All right, we'll change it. Yeah. I think you should change your username. No one wants, like, anything is better than COVID as a username at this point. Like, seriously. There's literally people in Japan who like want to think about COVID still. Like they like actually like want to think that's how they like feel good about their existence, is like they live in that headspace still, masked. Like I skateboard past people on the street who are like masked. And I'm like, why are you like, it's low IQ. You have to be pretty low IQ to like wear a mask at this point. There's no other explanation for it. Like you can say like, oh, they just want to like, be safe or like not put on makeup if it's a chick or something. I'm like, nah, it's just low IQ. Like, you can't really justify it any other way at this point. HUD, give me a membership for free so I'm poor. The memberships for my fucking YouTube channel are like 99 fucking cents. Literally. Give you a membership for free. And I don't even get anything from that. You think YouTube fucking gives that to me? You pay your little 99 cents for be a bronze member of my channel. YouTube takes like 80 cents. It's so expensive for me. I can't afford, but I enjoy all your videos and keep sharing it with my friends. That's cool. Usman Malik. Hey, hi, old grad with home residency could match in surgery in UK. What are you asking? I don't know if it's like a sentence fragment. Guys, give the video a like if you're coming in here. Krishna, hello, my sir. Exam on August 28th. Okay. I give NBME 20 and 31, 25. Should I start NBME from like, guys, can you like put sentences together? Like what? Like what are you writing right now? Christian Angulo. Like you gave up your spot in the quote, you know what I mean? You know what I mean? Like I'll if you ask a question, I'll get to it, but like, now you gotta wait fucking 20 minutes or something because you couldn't put an English sentence together. You gotta like fucking use your audio transcription or whatever. It's like spend 2 fucking seconds making sure that whatever you convert from audio to text is actually like, you know, legible or something that can be read appropriately, right? Krishna, nice eye. All right, super chat. You get priority, right? This is how it goes. Gala, thanks to your $5 super chat. Hi, Mike. Should I read all the explanations for online online NBMEs 25 to 31? It takes a long time and so boring. Can I read only my incorrect? You don't have to worry about the explanations that NBME puts out. You can scan them. That's okay. You don't have to obsess over them. Like, I want you to obviously go through all the NBME exams, 20 through 24, free 120, 25 through 31. Yeah. You don't have to obsess over the actual explanations. I'm content, and I've said this as like a tactic, okay? I'm content with you going through the online NBMEs, any NBME for that matter. You find the correct answer, you're like, okay, the answer is B, and you can fucking copy and paste that actual entire NBME question with the answers, everything, into ChatGPT, and it will give you explanations, okay? And you're like, well, why is it not A? And it will fucking explain it to you, okay? Now, the caveat, and I have to communicate this, is you must know the answer to the NBME question before you ask ChatGPT, because sometimes it's wrong, okay? Some students have complained about that. So you want to know the answer 100%, and then ask ChatGPT about it, and you can get really good, makeshift explanations that way. You got to start using it as a tool. ChatGPT can be wrong sometimes. Then you got to probe it. You're like, are you sure? Are you sure? And then it'll be like, oh shit, actually, I meant the complete opposite of what I just fucking said. So you got to probe it sometimes, but like, you can get pretty good explanations. Saves you time versus, asking dumb questions in the Telegram group, right? A lot of you guys ask dumb questions in the Telegram group. Let's see. So yeah, thanks again for the super chat, Gayla. Now scrolling back up. Ryan Appolion. Good to see you, Ryan. What's going on? Diego Dugarte. Good to see you again, Diego. Guys, give the video a like if you're coming through here. Appreciate it. Ali Harby. Hi, Doc. Like people in Reddit kept saying that new step 2 is very hard. I did the new free 120, which is now changed, got 82.5%, and NBME is between 248 and 253. I'm confused what I should do. It's laughable, isn't it? Like when you're getting high scores like that, I mean, I understand. Like you obviously want your, rather than a 248 to 253, you want your, wouldn't a 268 to 273 be nice? I get it. It's laughable because probably 80% of people, watching this / in the Telegram group, etc., they just want to pass. So you're like, I'm getting 253, guys. Like what should I do? Have you gone through my PDFs? Have you done that? Have you gone through my MCQs on YouTube, like the internal medicine playlist in particular for 2CK? I don't know how far out from your exam you are either. I'm assuming if you're doing the NBMEs for 120, you're pretty close. But you got to be consolidating around all that content. Have you done the CMS forms twice? I've said do the CMS forms all twice, right? I wouldn't sit the USMLE until you've done the 2CK, until you've done all the CMS forms twice. So I postpone students in all capacity if they're either failing, that makes sense, or they have for 2CK if they haven't done the CMS forms twice and NBMEs 6 through 14, including free 120, and all of the QBank, Amboss, or UWorld. You got to get through all that stuff. Even if you're scoring like 253 and you're like, well, I did the CMS forms like once and I did like some of the online NBMEs, I'm getting a 253, and I did like 80% of UWorld. I'm like, you're stupid, because if you had finished UWorld, if you did 2 passes of all the CMS forms, if you did all the NBMEs 6 through 8 offline as well, you'd be scoring higher. You're asking about, you're confused. You literally, I'm reading your words. You say, I'm confused. What should I do? I'm telling you, you got to go through the CMS forms twice. Ali Farhan, guys, give the video a like for coming to the live stream here. Ali Farhan, hi, happy to see you. You've been a big help in my USMLE journey. Diego Dugarte, should I make Anki of just wrong questions? I've said for NBME exams, you want to do that. So not UWorld, but for the NBMEs, yes, you're going to be making Anki of your incorrects, right? I've inculcated that. I've said that, right? I've talked about that a lot in all my live streams. You've been in my live streams, right? So, when you're going through the NBMEs, guys, you're going to screenshot your incorrects. I am not going to do this very second. I'm not going to give the 20-minute spiel about how exactly to do that. I can. There's nothing preventing me. Why not? But I'm just saying qualitatively, for a short point of consolidation, is that you should be making screenshots of your incorrects from the NBMEs into Anki. And you're going to be reviewing those. A cumulative stacked review type of style, where you continually review those incorrects as you move through the final month doing the NBMEs. That's basically just step 1. I don't have people for step 2 do that. You say, why not do that for step 2? You could. It's a different style. It's a different process, because we have 2 passes of all the CMS forms. It's a shitload of reinforcement already. I'm okay with people not making Anki. If you want to make Anki from the CMS, if you want to do all that, you could add time onto your prep. I don't see it as critical. Okay, but you could. It's no different. When I answer these types of questions, it's no different from a student saying, why do you recommend NBMEs 20 through 31? Why not NBME 19 through 31? Why not 18 through 31? Okay, why not for 2CK? Why are you saying 6 through 14 in free 120? Why not NBME 4? 5 doesn't exist for whatever fucking reason. Don't ask me. Okay, but it's like for step 1, I think it's NBMEs 10, 11, or 8, 9, and 10 don't exist offline for step 1, which is weird. It went up to 7, and then we skipped 8, 9, 10, and then it went 11 through 13. There was no 14 offline, and then 15 onward, we've had NBMEs for step 1. So that's fucking weird too, okay? But you say, why not do all the offline forms? You could. You could do a lot of things. I come up with practical plans, like things that are like both highly effective, but also doable. And, Mubashar. No. Ayad Ali. Hey, Mike, what's going on, Ayad? Good to see you back. Mubashar, Perzad. Good to see you back, Mubashar. Hello, Mike. Is it okay to take step 1? Is it okay to take fucking dyslexic? Mike, is it okay to take 1 week break? I have to go for an emergency trip somewhere. Yes. You're not allowed to take an emergency. You gotta someone's sick in your family and dying, and you gotta know you're not allowed to see them. You have to sit in your room and do UWorld. That's what I'm going to tell you to do. Yes, you can go. You can attend to your emergency. Probably good refreshment, truthfully, having a week off from prep, for the sake of equanimity. It's okay to be gunner and you're hardcore, about everything. It's fine. Mimi Lele, I'm prepping for step 2. Philip Radunovic. How should we do offline NBMEs? Saw Anki decks floating around. You need to make your own Anki for the NBMEs. That's a decent question because sometimes people will ask for pre-made Anki decks with regard to NBMEs, that type of thing. You need to make your own because, as I've harped on, it's the screenshots of your incorrects that matter. It's custom review. Okay, so you got to make your own screenshots from the NBME exams. And you say how to do the offline NBMEs. 20 through 24 offline for step 1, which I've said to do, or 6 through 8 for 2CK offline. You don't have to time yourself, but I don't want you taking all fucking day either. I don't want it to be tutor mode. I want it to be, you're going to do all 4 blocks like it's the real exam. You don't have to have the timer, but don't take all fucking day. Just be like, I'm feeling like I'm working at a decent pace, even though there's no clock, but don't take 5 minutes per question. Just work through. That's the offline ones. Get your scores on them. Yes. But when you're taking the online forms like 25 through 31 or 9 through 14 for 2CK, you need to time yourself. And if you're sitting those forms offline because they're in our Telegram group, that's okay. Just make sure that you have like Google Timer or like a stopwatch or something. So you're timing yourself and you can Google about like, how much time you need per block. If it's like, 72 seconds per question, whatever it comes out to be, just make sure you know how much time it is per block. You got to time yourself with the online forms if you sit them offline. Ryan Appalayan. I'm very devastated today. Yesterday, I found out I failed step 1. I memorized NBMEs 20 through 24 and 25 through 28. On the last 3 NBMEs, I got 68, 68, 70. Now I'm not sure what to do. Well, first of all, I'd want the 3-digit scores. Okay. This is very important, guys. Listen up. 68, 68, 70 is not bad. Those are passing, I'm fairly sure. But what I want you to do is take your 2-digit percentages and convert them to 3-digit scores using Google Images. Type in NBME 27 score conversion Reddit, NBME 30 score conversion Reddit. You get a graph, you convert each percentage to a 3-digit score. And I want to see 205, 210 plus for step 1 for each of your forms before you sit. 197 is the internal pass mark for step 1. So I don't want you getting a 200. I don't want you cutting it close. I want 205, 210 plus. Now 68, 68, 70 is like not bad, right? But I want you sitting, I want to see those scores. I'd be sitting down with you. Like if we were chatting and, you're telling me, you come to me or something, you're telling me this over the Skype. I'd want to know the exact fucking dates you took all the NBMEs because you say you memorized 20 through 24. I'd be like, when did you fucking sit them? I'd want to know the dates. I'd want to know the scores. And I'd say, how did you memorize them? Did you actually do a stacked Anki review like I've harped on? Okay, like how did we move through the process? And then I would be an asshole and tell you like, why didn't you do 29 through 31? I mean, I don't know if those are, because you didn't mention 29 through 31. If that's the last, and if those are the last 3 NBMEs you're referring to, and it's an elliptical statement and that's 29 31, but you just didn't mention it. But if you did 20 through 31 and your scores were genuinely, 205, 210 plus prior to sitting the real deal, there's a catch in there. I'd be like, well, what did you get on some of the other forms recently? Did you get like a 194 fucking 2 weeks out in an NBME? Did you take a fail on an NBME like a week and a half out and you're just not telling me, even though the others were okay? If I have a student take a fail on an NBME in the final, like it's subjective, maybe at least in the final 2 to 3 weeks, especially, I postpone him or her an entire month. And I go back to Q banking corrects for an entire fucking month, not 2 weeks, a whole month. And the student's like, well, I don't want to do that. And I'm like, great. So don't fail the NBMEs then. Like I tell the student beforehand, I'm like, you're going to sit this exam tomorrow or on this day. These are the NBMEs you're going to sit on these days. And just know that if you get below X score, my prescription is you're going to be going back to fucking like Amboss for a whole month, or you're going to be doing your UWorld incorrects for a whole month, not 2 weeks. And the student's like, well, I don't want that. I'm like, great, then fucking do well in the NBMEs. and it's like an incentive, right? Incentivizes. So, you know, that's the too long didn't listen, is I'd have to sit down with you to discuss the nitpicky specifics of your scenario to diagnose what exactly occurred. SARS COVID says wrong fucking answer. Yusef Joid, hello G. Bugra Basarmak. Do you listen to metal? Not really. Bugra, I think it's the first time I've seen you in my live stream. Where are you at? Where are you at? You in like Bulgaria or something? Why don't I just say Bugra? It's Bulgaria. It's similar sounding, right? Where are you from? I went to Sofia, Bulgaria in 2018. Ahmed Elaman, no question for today. Just here to say I appreciate what you do for us. Thanks, Ahmed. Salwa Nasser, is it possible to increase your score by 10% in 20 days? Exam in July last week and scoring mid 60s. As I said, I want you converting your NBMEs to 3-digit equivalents. The reason I do this, guys, cumbersomely for you, is because a 65% correct on one form is not the same as a 65% on another form in terms of scaling. Okay, so we have to, it's like converting Celsius and Fahrenheit. So I want that 3-digit score. So I want to see your NBMEs. I want the dates you sat each NBME. I want to know how many wrongs. I want to know your 3-digit score equivalent for each of those NBMEs. And then I can sort of assess when you're going to sit the remaining NBMEs, and if you actually need to take a step back from NBMEs and spend an entire month doing incorrects from UWorld. Because mid 60s is borderline. And as you just have this, Ryan up above was talking about how he had a 68, 68, 70 on 3 NBMEs and didn't pass. So it can be a precarious scenario if we have to, make sure that those 3-digit scores are good. Guys, for coming to the live stream, give the video a like. And subscribe to my channel if you haven't already. If you're in this live stream and you're not subscribed to my channel, you're a fucking asshole. How's that for community development? Right? Mohammed Akhtar. Hey, Mike, love your work. Got a question. 58% and made me 29 a week ago. That's a fail. Just got 60% and made me 30. That's also a fail. Test in 9 days. Should I reschedule? 100%. So what you're going to do is your test is in 9 days. So roughly, I don't know. Well, it's the 3rd of July here in Japan right now. But for you, it's the 2nd of July, I'm assuming. So your exam on the 11th. So you're going to spend the rest of this month doing UWorld incorrects or MBOS. That's what you're going to do. So you're going to do the entire month of July QBank, 40 questions per day in the morning. You're going to take lunch. You're going to do 4 blocks of 10 untimed tutor random this entire fucking month of July. You're going to have lunch. The afternoon, you're going to go through my PDFs: cardio, pulm, renal, gastro, heme, derm, immuno, biochem. You're going to knock out all the PDFs in the afternoon. Go through my YouTube playlists. Okay? It's going to be all of July for you. Then, August 1st, you can sit NBME 20 offline, and you can see how you go. I would put your test, it's a long fucking discussion for you, but I would put your test on at end of August. So what I would do is have you do all of QBank incorrects through July, and then you're going to have an entire month, all of August, where you're doing the NBMEs. That's what I'm going to have you do. You say, I don't want that. I don't want to sit it that far in the future. Are you serious? My exam's for July 11th. I don't want to sit end of August. Don't fucking ask my advice then, right? I only know how to get you to pass. Don't take my fucking advice, right? I mean, you took 2 fails on NBMEs. You just said you took a 58% on NBME 29 a week ago. You literally said you just got a 60% and maybe 30, which is a fail. So that's not my fucking opinion. Those are objective scores. Don't take it up with me. Take it up with the NBME exam. So why would you sit in 9 days? You're not. And then even if we can augment your score toward the end of the month and YOLO, I don't want people YOLOing. Right? I don't want people YOLOing. You only YOLO if your school forces you to. If your school's like, fuck you, we're going to kick you out of med school if you don't sit by X day. And you're like, I can't move it. I can't. I have to sit it. No matter what, I have to. That's the only time I have a student YOLO, and I never like it. So, Mohammed Kadrari. Hello, dude. What's going on, Mohammed? I have like 49 Mohammeds in my phone with all different spellings. Probably more than that, actually. Probably more than that. Mamie Lele. Now only I saw your Q&A. Muhammad Hassan, yesterday I told you I only have a sore throat and mild fever. My parents went to pharmacy and told them about my symptoms, and he gave them medication for sore throat, which is fourth generation cephalosporin. Laughable. You would never give someone a fourth generation. I don't know if that's a joke or something. I don't know if you're colloquially sort of just like half joking, where you're like fourth generation as in like old school fucking Ceph. Because fourth generations like cefepime are used for Pseudomonas. That's when you give fourth gen. For 2CK stuff, for nosocomial, hospital acquired, ventilator acquired, you're going to give someone vancomycin for an infection such as a neutropenic fever. You're going to give vancomycin, which covers your MRSA, and you're going to give a third generation ceftazidime, which covers Pseudomonas, or fourth generation cefepime with an F that covers Pseudomonas. Ceftriaxone is insufficient. Vanc plus ceftriaxone, that's broad spectrum for community acquired. So if you have like community acquired sepsis, you can give that combo, or just ceftriaxone alone shows up a lot on NBMEs, like SBP, spontaneous bacterial peritonitis. You can just give ceftriaxone straight up. Okay, a severe strep pneumo infection with sepsis, that's community acquired. You can give ceftriaxone straight up. It's an answer on the NBME, plus or minus Vanc. There's like a newer form where it's ceftriaxone plus Vanc. Student says, why are we giving Vanc with the ceftriaxone for the strep pneumo? It's posited that some strains might be resistant. There's increasing resistance, quote unquote, maybe. So it's like ceftriaxone plus or minus Vanc is the big picture concept for complicated community infections. But for nosocomial, if someone's been in a hospital for at least 48 hours, within 48 hours, someone has an infection, we still call it community. But if someone's been in a hospital for at least 48 hours and then has a nascent infection, an incipient infection, that's considered hospital or ventilator if they're on a ventilator. And you have to give Piptaz, piperacillin tazobactam. USMLE doesn't really assess it, but you could. Or you're going to give a third ceftazidime or cefepime plus Vanc. That's like very classic. Okay, I mean, there's other regimens, but that's when you say here that you're given a fourth generation cephalosporin for a sore throat, it makes no fucking sense unless it was hospital acquired, and you would never give that on its own. Fifth generations like ceftaroline, ceftobiprole that supposedly cover MRSA, never fucking seen them assess. It's just like, textbook nonsense. Ali Farhan, what's the best plan to start step 2 CK journey 1 month after step 1 result? And how many UWorld questions to do every day? Well, it's going to take you 4 months to prep for 2CK. Because you're going to do 2 months QBank. It's going to take you 2 months to get through the 4,100 questions in UWorld, or 3,700 questions in Amboss, and then you're going to do 8 to 9 weeks where you're going to have all the CMS forms you're going to do twice, and you're going to do 6 through 8 or 6 through 14 and the free 120. Guys, give the video a like for coming to the live stream. Give the video a like. Sub to my channel if you haven't already. There's clearly some of you here who haven't subbed to my channel. I see the analytics after these videos. Like I can see that there's like, there's people who are not subbed who watch the videos. So people are like, I'm not gonna sub. Okay, don't fucking sub. I think you should sub to the channel. It's a good idea. I put out daily MCQs. Anas, Mike, I love you. Philip, LMAO, Philip. Maskers on blast tonight. Love to see it. Nassan, just changed it. Can you see my new username? Good. Better. Better than your SARS-CoV-21. Literally. Better. Mohammed Hassan. You guys all sound the fucking same. Nassan and then Mohammed Hassan. In my country, they prescribe antibiotics for anything, even for small runny nose, they give antibiotics. What do you think the next generation of antibiotics after the resistance dominate? No fucking idea. I did an ID, like when I was 20, I did like a study abroad in Sydney, Australia for a couple months. And the infectious disease specialist told me, he's like, there's 3 certainties in life: death, taxes, and microorganisms always become resistant to new antibiotics. I mean, I don't know, like in terms of new antibiotics, I'm not an ID specialist clearly, but like, yeah, just AI is going to solve a lot of that stuff. Let me see. Jinty Gibson. Opinions on vax mandate? I don't think people should have been. I don't have strong opinions on it, but I was triple vaccinated for COVID, but like I didn't want to do it. I did it because I travel a lot and I needed a vaccine passport to go international. But it like pissed me off because like I wasn't scared of COVID. I was like pissed off. If I had been living in the US, if I had been living in like Florida or something, I would have been like, fuck these like rules. I'm glad I don't have to wear a mask here. Like I was happy to like, I'll get sick. I don't care. It's just like, but once again, I think my views are augmented in that direction, in a dismissive direction, because of being in Japan, where everyone is fucking whiny here. Like it's whiny. I've said already. Literally, like maybe at least a quarter to a third of Japanese, maybe more than that, at least a third of Japanese, like are like still wearing masks. You ask them like, why are you wearing a mask? They're like, I don't know. I'm scared of COVID. It's like, you're low IQ. I don't know what to say at this point. I just stoop to the level of like derogatory, like, because like, what do you say at this point? It's like, why? I don't like weakness. I don't like mental weakness. That like inefficiencies created by mental weakness. I really hate that. I think that's why I come off dismissive in that regard, because it creates like inefficiencies for other people, and like it just like walls off society. You have this insularity, like negative, like you have this like it's a negative social like implementation at this point. It's adverse for societal progression at this point. Mimi Lele, Mike, I want your advice for UWorld. Is how important for step 2? So I got 60 70%. Only a guy with tutor mode exclamation point. I've said you're going to do all of QBank. C Houston, what would you say would be the best way to study OBGYN? You're going to do all of QBank for OBGYN stuff. You're going to do my OBGYN Repro PDF. You're going to do my OBGYN Repro playlist on the YouTube. You're going to do all the OBGYN 8 CMS forms twice. And if you have an extended rotation, sometimes people have like 12-week OBGYN rotations for whatever reason. You can even do a QBank called UWISE. Holy shit. Not UWorld. UWISE. There's like another OBGYN special QBank. Only do that if you're on like a long rotation. Don't do that if you're just studying for TCK and only that. But UWISE can be another source of questions. Jojo, I think lenses are beta with respect. I mean, you got your. That's what I'm saying. Is you got your people will latch onto straws. That's what they'll do. That's what they'll do. Latch onto straws. Let's see if Mike will get reactive to my little provocation. Right. Let me be some random anonymous cuck uh, with a wannabe anime username, and then make provocations, and let's see how Mike reacts to it. Right? I'm joking. Relax. We're all friends here. Abdul Amar Abdul. Hi. Does home residency help? Year of graduation 2014. It hurts. The United States, they like people to train straight out of med school because you're going to learn your own regimens and in hospital uh, the applications of the medicine that are unique to your country, and then you come to the United States and right. So oftentimes, if you've been trained already, that can be adverse. But you have to sit step 3, the year that you're applying. If you've been out of med school at least 3 years, you need to sit step 3. If you've been out of med school within 2 years, you don't have to sit step 3. But I like to say, do step 3. There's no objective data on it, just my opinion. I just think sort of subjectively, the utility of step 3, it proves that you still are up to date on knowledge. You haven't detrained, right? At least like with your theoretical knowledge. So I'd sit step 3 if you've been out of school for a while. You say 2014. Mohammed, but ChatGPT is 90% wrong. No, it's not. No, it's not. I'd say like you do have to probe it. Sometimes it can be wrong, and then you have to just be like, do you mean this? Or you have to push it sometimes. 90% is excessive. No, it's not 90% wrong. But it's better than Google, in many respects. Like Google, you have to fucking literally search absolutely everything. So like it's still better. It's better to like it's still more efficient to have to probe ChatGPT and be like, are you sure? So you're sure it's this? Okay, just confirming. So this is correct. It's still better and more efficient to do that with ChatGPT than it is to like continue your meandering Google searches like indefinitely and trying to click on bullshit like web pages and stuff to find one little piece of information. Hello, sir. Krishna says, I gave NBMEs 20, 25, 31, and I got 60% above. And now I have exam on the 28th of August. So I should start from 20 to 31 now, or just before 1 month of my exam. 28th of August. If your exam's 28th of August, I want you starting the NVMEs July 24th. I don't want you touching any NVMEs right now. And you're going to redo 20, 25, and 31. When you get to July 24th, you're going to redo 20, 25, and 31 in that order. You're going to redo them. And we're not going to care about your scores because you've already sat them clearly. But then after you finish 20, 25, 31, you're going to start with 21 and just work your way up. That's what you're going to do. Gayla, thanks a lot. Mohammed Hassan. C. Houston, hello tomorrow. I got 74%, 3 different NBMEs for step 1, solid. But UWSA was 217, 64%. Exam in 2 weeks. What shall I do? Fuck UWSA, dude. Like, this is why I don't prescribe the UWSAs oftentimes. Like, your NBMEs don't lie. You got to sit all the NBMEs. That's what I care about. That's what I care about. Sit all the NBMEs. Ali Harby. Ali Harvey, I know a lot of people want to pass, but I'm not showing off. I did all your videos, PDFs, QBanks, CMS twice, but the scores for recent test takers are getting lower and lower from their NBMEs. From their NBMEs exam in 31st July. You're saying that are you implying that, are you trying to say that recent test takers' actual performances on the 2CK are coming out lower and lower in comparison to what their their practice NBMEs were? I would say that's an illusion. I would say that's just an artifact of reading too much Reddit, because this isn't rocket science. you're going to get these minority posts that get amplified. No one goes on to Reddit and is like, hey guys, my NBME, I was getting 226, 227, 224 on my NBMEs, and my real deal was 226. That type of post doesn't really get amplified. What gets amplified is like one fucking person out of like 100, who's like, I had like 220s and then I like failed, or like I got, 220s and then I got like, you know, 20 points lower or something. So it's like those are the type, it's the outliers that get amplified. Muhammad Abadi. I've done your genetics PDF. It's hard. It is hard. I had 99th percentile on AMBOSS genetics blocks yesterday, but with your PDF, barely 40%. Wiped my self-esteem. It's a hard PDF. It's harder than the NBMEs, my genetics PDF. But if you know it, you can nail all the Hardy-Weinberg stuff. It's a hard PDF. I wrote it when I was on quarantine, like a couple years back, because I was in Italy. And I flew back from Italy, and I had to do fucking 6 days of quarantine in Japan in a fucking hotel. And I was like, well, I'm gonna like convert this time that I'm not allowed to leave this stupid hotel into. And I pumped out the entire genetics PDF. I literally sat in a fucking room for 6 days, and I did that genetics PDF. All that quarantine stuff was so low IQ. Like I really hate like dumb political interventions like that. It's like had no bearing in reality. It was like when there was like that Omicron variant. That's when it happened. It was like everyone freaked out. And it was like we like started to have a laxing of like protocols, and then there was like maybe a 10 to 20% laxing where people are like, okay, maybe things are starting to improve. Then we had like an Omicron scare, and they're like, you have to quarantine for 6 days automatically, even though we have no evidence of anything that's a problem right now. Ayatollah, what makes something high versus low yield? Is it only according to what shows on NBMEs? Correct. That is correct. Shows up on an NBME doesn't mean high yield. Okay. Correct. If it shows up repeatedly, that's when it's high yield. Okay. Diego Dugarte, thanks, boss. You're the goat of USMLE. Marwan Eltani, what should be my priority branches while studying for step 1? Please mention all branches in order. Branches? What the fuck are you saying right now? What are you talking about? Like brachial plexus? Like what are you talking about? I mean, I've said tetrad. I've said like QBank. I said my PDFs. I've said my YouTube MCQs. I've said, you're going to finish on the NBME exam. So if you're starting to study for step 1, you should just be going through QBank for sure with my PDFs and my YouTube MCQs. June Lee, hey Mike, Chanja boy is here. Yeah, well, I mean, you shouldn't, considering you're Korean, you should know that Chanja is Korean. I had more Chanja today, actually, with dinner. I had a big piece of grilled chicken. I had a big salad. I had Chanja. And then I had like another smaller salad with like some avocado in it. Ahmad Arif, I'm getting 78% on UWorld Step 2 system-wise timed mode. 17% done. I have exam in 4 months. How should I go from here? You're 17% done. Please. Just finish UWorld. I don't even give a fuck what your scores are. Just finish UWorld. And then after you finish UWorld, I've said don't do system-wise. 78%, I mean, it could obfuscate like your actual true performance, because subject specific could lead to an artificial inflation sometimes. If you're doing like short blocks, that it can lead to an artificial augmentation, because you transiently learn material and then that can apply like somewhat acutely the next day. But regardless, it doesn't matter, because you're gonna finish QBank and then you're gonna go on to the CMS forms. And then on 6 through 8 NBMEs, double pass of all the CMS forms, and then free 120, and then 9 through 14. That's what you're going to do. Mohammed, guys, if you're coming to the live stream, please give me a like. Mohammed Abadi, after exhausting your PDFs, do you recommend one last pass over FA? Massive cuckery. I've never recommended that. The FA era is over. It's a waste of time. It's too much information. It's a pass fail exam. Like, it's 2023. I'm gonna have to deal with this annoyance, for a bit longer, because my awareness for what's going to get you the highest score obviously is ahead of everyone else's. So I have to imbue that and let you know what's going to get you a high score, but the community is going to take a while to catch up. You get people who still think like Kaplan is how you prepare, right? You'll talk to like school advisors who are like, read FA and do Kaplan, or like read Robbins. Like, you get people who have like no idea what they're talking about. Patrick A, with step being pass fail, if you can, do you suggest completing all your recommended prep over a longer period of time during med school and use the dedicated period for things like research? Absolutely not. I've never heard of such a bad idea in my entire life. Imagine using your dedicated prep period for USMLE to like do research that no one fucking cares about anyway. No one cares about your little like research project or this paper, that you're gonna get. You gotta like nail fucking dedicated for USMLE prep, and I don't care if it's pass fail. You have to, it's the licensing exam, so you're going to nail it, and then recognize that knowledge you gain over the dedicated is still going to help you for 2CK when you get there. The best prep for 2CK is solid step one prep. Remember that. You're not like, you don't want to shortchange yourself on step one. Weaker students I have for 2CK, what they have in common is they lack step one knowledge. I'll have people like a week out from their 2CK and they're like still vacillating over, they're still ambivalent about some like SIADH versus psychogenic polydipsia versus diabetes insipidus question. This is like high yield arrows stuff for step one, right? Philip Radunovic, thanks, Doc. Really appreciate the advice, Mohammed. Because I'm kind of afraid that test makers start making questions from resources other than NBMEs. I don't know if you're talking QBank or something like that. If you're asking, I don't really care. I mean, I think QBanks at this point, UWorld, Amboss, they just base their stuff off the NBME exams. 100%. 100%. Because if I'm in their position, they can't be that fucking stupid. You'd have to assume like, asinine, thought matrices at the top for them to be, you'd have to make that assumption for them to be using anything other than NBMEs. Imagine like leading like a UWorld or Amboss like group, that's like trickle down in terms of like, we got to have people make new questions. What's our template? How are we going to go? What's our process for doing this? They're like, go to Kaplan. No, that's not what they fucking do. They're like, well, go through the NBME exams. You can look at old NBMEs and just make questions that are similar. They base them off the NBMEs. That's what they do. People don't complain that UWorld or Amboss artificially inflate their score. They don't complain about that, even though they base the questions off the fucking NBMEs. But people will complain that my PDFs artificially inflate their scores because they look for reasons not to do. But QBanks, they make new questions off NBMEs. Mazrur, abortion and the pill aren't going anywhere. And because, how's that for a segue? Abortion and the pill, let's see what this question is. Abortion and the pill aren't going anywhere. And because of that, people are enjoying sex without having kids. Do you think humans will fix this themselves, or evolution will have to catch up and fix it? I could voice like my views very bluntly, but I've said many times there's no freedom of speech, right? There's no freedom of speech anymore. So if you want to talk about like, you could literally get on YouTube and be like, it's a good thing that Russia invaded Ukraine. I think that's good. Or like China engaging in cultural genocide in Western China with the Uyghurs. That's okay. No one cares. No one blinks an eye. But then you say like your opinions on male-female dynamics or something, people get triggered real fucking fast. Right? So I mean, I've said I'm pro-life. I think abortion's murder. I've said that. People, it's okay though. People have, different views on different things. You know, it's a polarizing topic, right? You have to be, politics is a way for things to get divisive very quickly. Because people, you give a view on something and instantly 50% of people, you alienate 50% of people, right? I say I'm pro-life and I think abortion's murder. That's 50% of people who are like, oh, I disagree. I don't like him, right? But I've said many times, I think life starts at conception. I don't think life starts at week 7. So I think I see abortion as murder. And I think I've said plan B as well. I view that as murder because it doesn't prevent conception, it prevents implantation. And once conception occurs, that's a life. And if you just induce an artificial period with a high dose progesterone analog, you have a life already. You have a conception that's potentially occurred, and then you flushed it out. I mean, I still view that as murder, but that's okay. People differ on their views, right? People differ on their views on economics, healthcare, you know. So guns, people have their own views. But I think it's not an accident that society, I mean, these populations are decreasing. It's not an accident. It's not difficult in terms of what needs to be done, right? It's not difficult. It's like all you have to do is just, if you limit, I mean, if you limit abortion and you limit, plan B, then populations will increase. And people will say, what about like rape and incest? Like exceptions can be made for rape and incest, yes. But you're talking like literally 0.1%, like lower than that, probably. You're talking the vast majority of abortions in plan B are just like, whoops, I'm not ready. That's the vast majority. People have different views. It's okay. You're allowed to be pro-choice. I'm not saying you can't have your own views. You're going to meet people with different views in the population. That's how like a society works, right? There's nothing wrong with that. But I mean, I view life as starting at conception, not at week 4, not at week 7, not at week 11. That's my view. But I think society, you need to eliminate abortion in plan B, and all of a sudden you're going to see populations increasing. That's what you have to do. But it's not politically correct. It wouldn't jive with politics right now. So it can't, I mean, the implementation of it, extraordinarily difficult. It's not like rocket science. It's not fucking rocket science. People are like, how do we incentivize people to have kids? Let's give them like $4,000. Not gonna help. That's what they do in Japan. They're like, Japan had the lowest birth rate last year in 123 years, since 1899. 1899, they had the lowest birth rate last year. The number of deaths in Japan was double the number of births last year. And the government's like, what do? We don't know what to do. They're like, let's give people $4,000 if they have a kid. It's laughable. It's laughable. Like, that's gonna help. If you give people $40,000, that might move the needle. Might. But it's called make abortion and plan B illegal. That's what it's called. And then magically, oh, wow, we solved the population problem. But it's not politically correct in terms of like, you get a lot of people who get very angry. You get protests in the street. You get like, people want to murder their kids. That's why they'd be protesting. They're like, we want to murder our kids. That's why, it's polarizing. It's polarizing. Can be divisive, these conversations. Ugra is Turkish. You're in Turkey. Turkey has the highest number of sexual partners per person. I have friends in Turkey. I mean, the women sleep around a lot in Turkey. I'm just like scrolling through the comments. I see Muhammad Ali says, why you look gay, Mike? That's a good one. So this is what's going to go down. There's 3 little dots next to you right there. Hide user on this channel, block. see, gone. I mean, you can make a comment, like take your swipe. You get your little like, okay. But what happens is you now forever you lose interaction, you lose your ability to interact with the content creator forever. You can make your little second username or your fifth username. Some people have nothing better to do, but I mean, you've lost interaction with the content creator indefinitely. That's what's just happened. People think that's I mean, I've said them 100% straight, but people think that's like an insult or something. Like, you look gay. What is this, like ninth grade? Right? Are we in like the lunchroom in ninth grade? It's like you're a fucking medical student or a doctor. You're going to be like ultimately, interacting with patients in a non judgmental slash empathetic way. You will be. And they're going to have differences from your own religion, culture, views on lots of things. And then, but you're okay, like taking your swipe at me because, um, you know, you've got things to work on. It's okay. You've got things to work on. We all have things to work on, don't we? Marcos Rocha. Good to see you, Marcos. I see quite a bit on my content. You're a good follower. Guys, if you're in the live stream, please give it a like. Thus far, I've taken 20 to 24 NBMEs and I've passed them with 205 plus. Good. Should my scores increase as I dive into 2531? My scores stay the same. They can often appear inconveniently stagnant. They can. It can be the same when you're going through QBank as well. Like you'll literally do the whole fucking like QBank, all of UWorld or something, and your scores are like not going up really. And you're like, well, how am I getting better? Like, why are my scores not going up? It's often like pretty normal. Just Marcos, see how 25 through 31 go. Just as long as you're getting 205, 210 plus, that's all we care about. Like I'm okay. I'm okay with you sitting insofar as you're getting 205, 210 plus. Like it's okay. Kanye, what's your typing speed? Would you say you have above average reading speed to be going through the cues so fast? Or is it because of I'm going through these cues very slowly, aren't I? Or is it because of the volume of cues you've done over the years? I'm not going through these cues quickly. My typing speed? I'm not a fucking secretary. Like, I don't like try to type fast, you know? You get a lot of people here using their voice to write, to audio transcribe into text, and doesn't come out clearly sometimes. But yes, I've done like many, many tens and tens and tens of thousands of questions over the years. I do questions 7 days a week with students. I teach 7 days a week, not 6 days a week. 7 days a week I teach. And I do USMLE questions every fucking day. Mohammed Abadi, Mike, the guy who said he has done the NBMEs and failed, made me freak out. What if USMLE is not that similar to the NBME? It is. You go, I know it is, but I want you to say things that comfort me like they are very similar. They're not similar, they're the same. This is objective, not subjective. The USMLE and the NBMEs are the same. When you go into the real deal, it's going to look like UWorld. Colors, calculator, lab values, it's going to look like UWorld. But the questions are the NBME questions superimposed into that UWorld appearing interface. When you go in there, it's going to be like doing an NBME 32 and 33 and a half or whatever. That's what it's going to be when you go in there. It's going to be like sitting NBME 32 and like half of an NBME 33. That's what the real deal is going to be. But rather than like the NBME interface that looks more like antiquated with the maroon, they have like some, I don't know why it looks different from UWorld. I don't know why they can't just make it look the same. It's going to look like the free 120. It's going to look like UWorld when you go in there. The questions are the same from the NBME to the real deal. Ali H, Dr. Mike, would it be possible whenever you update a high yield PDF, you could please mention it on your website, updated as of X date? I'm not going to do that. I know that would be convenient, but I'm not going to do that. And the reason is because it just creates headaches for me. Because you get people whine. I'll tell you why. It creates people fucking whining. That's why. You get people who are like, "Oh, Mehlman didn't update it since like February. Oh my god, I'm not gonna read that." Like, why would I want to deal with people fucking whining? Right? I updated the cardio and the poem PDFs today. Actually, I added carotid artery dissection to the cardio PDF. It's on NBME 13 for 2CK. Carotid artery dissection. It presents like a stroke, TIA retinal artery occlusion. So you can get like a thromboembolus launch off. You get thrombus within the false lumen, but you can get ipsilateral. They'll give you a stroke-like presentation with ipsilateral neck/facial pain. And the answer is carotid artery dissection. And you get, and the NBME explanation says there's ipsilateral neck/facial pain because of nociceptor activation due to vascular stretch. So nociceptor stretch secondary to vascular dilation is what it said. So that's like an interesting one. It's not crazy hard, but it's like it's a notable one. And I also updated for dissections, aortic dissection / traumatic rupture. When you do X-ray the chest showing the widened mediastinum, the next best step can be aortography, aortic angiography. But there's also a new question where it's just CT scan of the chest, which means CT angiography. You can do that also. But they just have CT scan of the chest straight up. Holy shit. They don't write CT angiography, it just says CT of the chest. So that can be like a little weird. That's an answer on one of the new NBMEs. So I wrote that. They're not going to have both. They're not going to have like choice A, aortography, choice B, CT of the chest. They're not going to do that. It's one or the other. But just CT of the chest, holy shit. That refers to CT angiography. Don't be confused. The pulmonary PDF, I added some stuff for tracheitis. There's a new question on one of the NBMEs about with tracheitis, where it's a diagnosis of exclusion. You have to eliminate to get there. Like they'll say there's no drooling or whatever, and you're like, okay, it's not epiglottitis. They'll say racemic epinephrine, 2 rounds of two boluses or whatever, racemic epinephrine didn't work, so it's not croup. And they say that the patient can open his or her mouth fully without a problem. That means it's not peritonsillar abscess. So you're eliminating to get there. And the answer, you're going to have stridor and a recent URTI, viral URTI, because tracheitis is usually Staph aureus as a secondary bacterial infection following a viral URTI. So stridor, and they'll say the patient can fully open his or her mouth. Holy shit. That's a weird, like, isn't that kind of a weird detail? You're like, I haven't heard that. So I literally put that in bold in the PDF. Patient can open his or her mouth fully. This is in contrast to peritonsillar abscess, a quinsy. That's what it's called, a quinsy, where you can't open your mouth fully. That's what it said in the NBME explanation as well. They said that in the explanation. I was like, I haven't fucking heard that. I'm the fucking tutor. And I was like, well, that's like weird. If something's like interesting to me, I'm just like, okay, but it mattered because peritonsillar abscess was wrong. And the student's like, why is it wrong? And we're like looking at it together and it was like, well, they fucking say it there. It's like, that's interesting. So sometimes the NBME explanations can be helpful. But tracheitis, it's a low yield diagnosis. It's like, we think of like croup, epiglottitis, those are like the high yield ones. And then tracheitis is sort of like the obscure nebulous one that like you may have seen in a resource. It's like you may have heard of it, but like when have you ever fucking seen it assessed? It's asked once on one of the new NBME forms for 2CK. Laughable. GG, hey, do you recommend, besides doing NBME my last month, reset UWorld? I do not recommend that. You said you've already finished UWorld. Your last score, NBME 27 was a 199, NBME 25, 202. In your final month, you're only going to be doing NBMEs. You can consolidate around some of my PDFs, but you're not doing QBank in the final month. You have to be focusing on 25 through 31 and free 120. LEH, could you explain the difference between DI versus, you said DI versus nephrogenic diabetes insipidus. Well, DI can be broken down into either central or nephrogenic, right? Right? I don't like want to spend these sessions like doing just like content per se. Like obviously, central will respond to vasopressin, to desmopressin exogenously, and nephrogenic won't, right? Central DI or SIDH, either or, can occur due to meningitis, head trauma, gunshot wounds, right? Nephrogenic DI is going to be like lithium, can be demiclocycline, can be hypercalcemia, can be NSAIDs. Ahmad Arif, hey Mike, examined 4 months, getting 78. Guys, if you're coming to the live stream, please give me a like. Hey Mike, examined 4 months, getting 78% UWorld untimed system wise. Tutor mode, 17% QBank done. How to go from here? I just fucking answered that before. I said just finish UWorld. Ahmad, is CBSE based on NBMEs and step one based on UWorld, which is what I was told. Step one is not based on UWorld. Step one is based on the NBME exams. But CBSE is the NBMEs for your school. Most schools have CBSE that are proctored by NBMEs. Nasan, my name in my native language means sleepy. Sagar Patel, hey Mike. Kabiru Ohikari. Hey, Dr. Mike, thank you for all your efforts. I'm getting between 36 to 42 questions right in each of IM and surgery CMS forms. Please, what recommendation do you have for the next? I mean, that's good. 30, like above 35 is what you want. Above 40, ideal. You just got to continue studying the CMS forms, obviously. Hardcore. Marcos Rocha, thanks for the super chat. I appreciate it. Thank you. Let me see. Michael Forte, hell yes. What's going on? Mohammed Hassan, is it a weird question, but nothing weird in science, right? Thoughts on why would I answer something like that? Nakia Brooks, hey Mike, just stopping by to say hi. Love the shirt. Back to you, world. Thanks, Nakia. Nassan, I used to have an anxiety attack every time I used to think step one, but now I'm completely indifferent. Joy Rahab Kalo, greetings, doc. Is it true that someone previously diagnosed with rheumatic fever as a kid develops valvular disease later on during their 30s? I mean, that's high yield. It's basic. Mitral regurgitation, when you're acutely diagnosed with RF, rheumatic fever is common. And then later on, the valve will scar over and you get mitral stenosis later in life. It's high yield. Joy Rahab Kalo, bonus question. What is your take on relationships during med school? Depends. It can help you study. If you're like really legitimately like trying to study hard for USMLE, it can be a good idea to, when I was 24 and I was studying for step one, my 18-year-old Aussie girlfriend at the time, like I would just study all day and then she would go out and like party or whatever. And then, she'd like come back to my place like 2 a.m. That was the routine, like that was convenient at the time. I've talked about that on my previous live streams. Like if you can, when I was studying for step two, it was way different. I was way more distracted. If you're trying to go out and like you're doing the whole like, approach, meeting a lot of people type thing, like while you're trying to study for USMLE, it's not a good combination. Like it's hard to be in a focused study mode if you're trying to simultaneously like I'm going to go out, do the whole dating thing. Like it's a you're talking two completely different focuses. You're either in social mode or you're like in hardcore study mode, and people try to coalesce or amalgamate the two, and that's going to be challenging, isn't it? Azad W. My school requires 68% on CBSE before sitting for STEP. Do you think this is fair? It's fine. I mean, yes, schools have different thresholds for USMLE. 68% is a decent performance. You got to be able to pass. And 68% is like, yeah, it's a decent bar. Asana Sif. Mike, is it necessary to finish 100% of UWorld? I mean, 80 to 85% is not enough. I would do 100% of UWorld, yes. Mamdu Al Nasirat. What time is it for you right now? It's 5:37 a.m. on July 3rd, Monday, here in Japan. Ali Ahmed. That's a good one. That's a good one. I'm gonna just hide you from my channel. Gone. I mean, this is like a, it's a quotidian thing. It's a very redundant type of occurrence. People like to criticize appearance. That's a good one. You get used to that. I said you got to handle that. Like if you know, and I've also said that people who talk shit, the amount of shit someone is willing, like actual, like, you know, vilification, like the amount of like slander and vitriol someone is willing to put forth on the internet is directly proportional to how much of a nobody they are. That's like people with actual influence. If they like post stuff, you can call me an asshole in terms of how I like come off or communicate. That's one thing. People who like actually like write like their fucking comments and stuff, like they go on like fucking Reddit, they do what they're gonna do. People who talk fucking shit, they're like, they're not like influential, so comes from people who are nobody. Because people who have actual influence, they have more to lose. They tend to be nicer. Ugra, do you have any suggestions to study ophthalmology? Um, I got to make an ophthalmology PDF. I actually just created an ophthalmology playlist on my YouTube, actually. I did. So what I did is I cumbersomely, very annoyingly, like Google searched all my opthal questions that I could find, and I like literally had to go back and make them into a playlist. And I probably missed some. I'm sure there's some like titles where I didn't label them as ophthalmology, but they were ophthalmology, so I probably didn't capture all of them. But there's probably like, I don't know, 8 ophthalmology questions. Like I will eventually make like an opthal PDF of some kind. A year from now, let's just say there's going to be other PDFs, there's going to be other, stuff I have out the same way a year ago I didn't have like certain updated resources. Muhammad Hassan, Marwan means by branches the specialties of residency. This is what we call here. Herschel Patel, is FA worth the clinical shelves and step 2 CK? I would say just for clinical shelves, you got to do QBank. You've got to do my PDFs. It's better than FA. Do my YouTube playlists for the shelves. And then you're going to do the CMS forms twice for each shelf. That's what you're going to do. Med, MEDD. Guys, if you're coming into my live stream, please give the video a like. And sub to my channel if you haven't already. If you're in this live stream and you're not subbed to my channel, that's a problem. Hi, Mike. My exam is October 3rd, and right now I have done 11% of UWorld. I just want to know, are 3 months good enough or should I schedule later as last month? You're going to finish all of QBank. You need a month for the NBMEs. So if your exam is October 3rd, you're literally going to start the NBMEs like around September 1st, literally. So you're just going to do QBank until you've got enough time. July, August, you got 2 months to do. This is perfect. Right? You have 2 months to do QBank, to finish QBank, and then you're going to do the NBMEs through September. You're going to sit October 3rd. Kanishka Awasthi. What are your views on BNB? I've said you don't need it. Ume K. Abbas. Hey, Mike, what is a safe NBME 3-digit score to book the exam? I've said 205, 210 plus, and multiple NBMEs. At least 3. Adam Gaby, goodbye. Hi, Mike. You've mentioned mental weakness. How can individuals improve their mental strength to become more assertive, whether during the USMLE test or in various aspects of their lives? I mean, I've said my views are not conventional on this sort of thing, but I do have concrete answers. Yes, right. I have to articulate that at the end of the day, this is still my medical stream, right? But I have very good answers for that. Yes. I mean, as a dude, you have to recognize that it's like going to the gym. You have to go out and approach people and take rejections from people, and that uh, will increase your non-neediness and confidence levels. Each rejection you take is a mini adversity, and you bounce from it, and you're masculinized in the process. The more rejections the male accrues, the more masculinized his behavior. It can't be faked. There's also a DNA component as well. Some people are just fucking complainers or mousy. So it's DNA times your ability / willingness to go out and incur rejections. It's like going to the gym. There's no entitlement. So, I mean, you have to put yourself out there and be told no a lot, right? You have to do that, and you do that for many years. So that's one prescription for getting there. And as I said, this is my medical stream, so I can go into more detail on that. I can be more blunt about a lot of that stuff. But you gotta go out there and uh, you have to approach women and you have to get rejected a lot. If you approach 50 women on the street, maybe 43 or 45 of them will put up their hand at you, not be interested to talk to you right away or whatever it's going to be. And then maybe 5 to 7 will talk to you. They'll happily talk to you. But you got to be able to handle like 43 to 45 L's instantly and not get emotional, not fucking make it about you. Right? And that's what strengthens the male behavior is taking the L's, taking the rejection. I've said this a lot, that the more rejection the male takes, the more masculinized his behavior. Muhammad Hassan, why warm autoimmune hemolytic anemia is IgG, but cold autoimmune hemolytic anemia is IgM? No fucking idea. All right. Just IgM, cold. That's how you can remember it. But that's like mycoplasma, it can be CMV. So if you have mononucleosis and you've got, a hemoglobin of 11, where normal is 13 to 17.5, and not in males and non-menstruating women, 12 to 17.5 in menstruating women, you have a hemoglobin of 11. LDH is increased. RBCs are packed with LDH. If LDH is high, that means hemolytic anemia in USMLE. Or if your Coombs test is positive, that means you have antibodies against RBCs. That means you have CMV mononucleosis. If you have a 23-year-old dude with, a fever of 100.5 and is walking around with bilateral wheezes and chest X-ray shows bilateral interstitial infiltrates, and Coombs test is positive, hemoglobin's 10, it's cold agglutinins from mycoplasma pneumonia, walking pneumonia. Warm autoimmune hemolytic anemia could be things like CLL, right? CLL can precipitate a warm autoimmune hemolytic anemia. USMLE doesn't give a fuck about warm versus cold. It's a moot talking point. What they care about is the meaning of a Coombs test. That's what matters. Because some of you, if I say Coombs test, you freeze. You're like, Coombs test, what the fuck? Like you don't you get uneasy about it. You're like, I'm not 100% sure what to make of a Coombs test. All it means is Coombs test. All it means is you've got antibodies against RBCs. Period. That's it. Okay. So if you have a 12-year-old who had a viral infection and then has spherocytes on a smear and has a positive Coombs test. They say, what's the diagnosis? Hereditary spherocytosis, wrong fucking answer. It's going to be hemolytic anemia. Student thinks it's an erratum. It's not an erratum. You need to know you can get spherocytes with autoimmune hemolytic anemia. And they said the fucking Coombs test is positive. I'd say, are you supposed to have antibodies in hereditary spherocytosis? No. Has nothing to fucking do with antibodies for hereditary spherocytosis. It's heterozygosity, AD. It's heterozygosity in anchor and spectrin band proteins. That has nothing. It's a cytoskeletal defect, cell membrane, RBC defect. It has zero to fucking do with antibodies. But you can get spherocytes and autoimmune hemolytic anemia. They'll say the Coombs test is positive. Okay. Or you have a blood transfusion and the patient feels an impending sense of doom. I've seen that on one of the the new surgery forms for TCK. You could say, isn't impending sense of doom like MI? I agree with you. It's fucking weird. Don't ask me. Don't take it up with me. Take it up the NDME exam. So they say, patient has a blood transfusion, gets an impending sense of doom, and they say the transfusion is stopped. What's the next best step in management? And the answer is perform a Coombs test. Because if the Coombs test is positive, you know it's ABO mismatch. And if the Coombs test is negative, it's going to be a febrile non-hemolytic transfusion reaction. Ashraf Mahmoud, what happened before the Big Bang, and what are we? I can answer. I'll get into that later. Maybe I'll try to answer some more med questions. Muhammad says nothing happened before the Big Bang because there was no time. I don't really like overanalyze stuff like that because like it's all speculation regardless. I think humans are fucking stupid. I think the Big Bang is like so stupid. It's like it's just even if we have evidence of some sort of acceleration of space-time that we think points toward this notion of a Big Bang, it's still just like a tip of an iceberg in terms of what actually is like occurring. Like whatever it means. It would be like, there's a lot of analogies, but I just think that it's very extremely like myopic and short-sighted in that it doesn't really matter. I don't care because I think whatever like humans attempt to assess, it's just like they're just wrong. AI is going to have to come closer to bridging that gap. AI is going to make a lot of those connections. And I think when AI makes those connections, it's part of the beauty of that is we're just going to have to trust it. Because we're not going to be able to, I don't think humans are going to be able to understand when a lot of those like high level connections are made, there will be veracity, there will be truth to the fact that like they will be outside of human comprehension. And like, you're just going to have to like trust it. It would be like somebody, like some mathematician just like telling you, this is the calculus for this. And you're like, well, I don't fucking know that calculus. I don't know. So I'll just trust you. You know your thing. I believe you. I don't need to. I get it. Okay, fine. I believe you. It'll be like that. I think the smartest humans will be like that with AI. They'll just be like, okay, I'll believe you on it. I talked about this in one of the prior live streams. It's not going to be humans that go to the stars. Humans are not smart enough to make it to the stars. AI will be what goes to the stars. Like chimpanzees aren't smart enough. They weren't smart enough to make it to the moon. Cats aren't smart enough unless there's a fucking land bridge. Cats aren't smart enough to make a fucking ship to, transit the ocean. They're not smart enough. Humans aren't smart enough to make it to Proxima Centauri. They're not smart enough. They're not going to do it. We're not going to do it. AI will do it. So, if you want to posit that it's like a cyborg that's going to do it, or but I think it'll just be digital transmission of some kind, or it'll be like light waves. It'll be some sort of like yeah, it'll be some sort of space-time transformation process of like um, but humans aren't going. Humans don't have a chance. It'll be AI that does it. Muhammad Hassan, nothing. I just fucking read that. Jash Patel, Jay Patel. How old are you? I said I'm 36 and a half. Let's throw a half in there. Devanshu Sharma, I'm using your biochem notes, helping a lot. Like, couldn't decipher UWorld and F8 together, but now your notes help me with the questions. That's good. You can do my biochem modules and my YouTube MCQs as well. Guys, give the live stream a like. And if you're not subscribed to my channel, please subscribe to the channel. Mohammed Al Rubai. Just discovered your channel only yesterday. I was feeling pretty defeated about preparing for this exam, but I feel a lot more confident now. That's good. Thanks for sharing your knowledge. Taking time out. Thanks, Mohammed, for joining the channel. Hopefully you're subscribed to my channel. Nassan, what is your view on marriage? People have asked me this. I think there has to be shared goals. I think the goals have to. It can't be just like, she's hot, he's hot. We have good sexual chemistry, and like we like spicy food, and we travel, and we like tequila and music, because those interests and those chemistries can fluctuate. So there's got to be goals like either religion or kids, lots of kids. People don't have kids anymore, so that's a problem. You got to have like lots of kids. I think if you just continue making kids, that's what will hold a marriage together. Like, I would never consider that unless the chick was basically just like having a kid like every like 10, 11 months or something. Otherwise, I wouldn't see a purpose to that. That's my view. Right? I don't fucking need to get married to have sexual interactions. You think that's gonna benefit me? Fucking marriage? Some guys are beta. It's nothing derogatory. Let's just be clear. It's nothing derogatory. But there's got to be, there'd be the notion is like that there's trade offs. I'm just saying I would never consider that unless literally the chick was, she's like ecstatic about the idea of like, she's like, yes, I want to just like produce like endless kids, and like that's what I want to do. I'm not interested in some chick who like wants to focus on career and like not have kids. That's not what I'm interested in. There's nothing wrong with that. People are allowed to do that. Some people don't want kids, or some people maybe want one kid. They want to focus on their fucking career or whatever. I've said I'm not attracted to females who are interested in career. And people take that the wrong fucking way in 2023. That's like considered like misogynist in 2023. To voice that you think like, you know, Mike said he's attracted to women who don't pursue career and just want to have kids. That's misogynist. That's misogynist. I fucking voted for Hillary Clinton. People want to call me a misogynist. If I were a misogynist, wouldn't I have voted for Trump? I voted for Obama, Hillary, and Biden. I donated to Hillary Clinton. And people want to call me a misogynist. How laughable is that? I don't know anyone who voted for Hillary Clinton. I don't know. I don't think I know a single I don't really know anyone who voted for Hillary Clinton. I voted for Hillary. I fucking donated to her campaign. That's what's laughable. Adam, goodbye. Is it a good idea to apply for a match without MSPE for med school? It is not a good idea. You need the MSPE/class rank. Annoyingly, you got to have it. Devanshu Sharma, is it if I only memorize your free notes, will I be able to clear step one? I don't recommend that. I recommend you do all of the QBank, my PDFs, my YouTube MCQs, and all the MDMEs. I don't recommend you shortchange yourself. Paula Savoya, not much time to study the whole UWorld for step one. Is a good strategy to memorize MDMEs 20 through 30. You mean 20 through 31 and free 120. I want you to do all of QBank. If you literally can't do all of UWorld, you have to sit soon. The priority has to be 20 through 24, free 120, and then 25 through 31. Yes. Markenzio, how is Conrad Fisher so famous even though his book isn't recommended? It's because he's an anachronistic resource. Okay. I mean, it's a different time and place. There's big names back in the day. Like, I mean, you're talking pre-internet. It's pre-internet stuff. Like, for example, Golian and Conrad Fisher, they were big names. Like, Conrad Fisher was pushed by Kaplan like 2 decades ago. Golian had his lectures, his pathology lectures recorded. Someone recorded like audios of his lectures and put them on the internet. This was before content was put out. This was like back in like 2002. So there was no supply of content. If Conrad Fisher had a fucking like podcast today, and he was growing himself from zero, he'd have to do the same fucking shit I'm doing, where he puts out content every fucking day. I'm not here to insert myself as a hubristic asshole, but I mean, I think my content's pretty fucking good, and it's like hard for me to break through. There's so much supply on the internet. You have to be really fucking good to break through. So it was back in the day, it was a trade-off. It was like there was less supply. It was hard to get out there. It was hard to get reach initially. But if you could somehow be fortunate enough to be put on, if Kaplan put you on, or if somehow like you got into a viral loop, like the audio caught a viral loop with like Golion or something, if you could get on like back in the day, that's how you became like quote unquote famous. But like now it's harder to break through, but the trade-off is like anyone can play the game. Anyone in the entire fucking world who has an internet connection can sit in like their fucking room and make content, and they have a chance to play the game. So everyone can play, but the trade-off is it's harder to break through. I've put out like, 1,100, 1,200 YouTube clips. My channel's tiny. There's no entitlement. There's people who put out like 200 videos and they have like, 8x the subs I do. There's no fucking entitlement. So, Devesh, should Robbins be used for USMLE Step 1? The answer is a hell no. Okay, this isn't 1994. Muhammad Ali. I thought I banned someone named Muhammad Ali from this chat already today. Like literally, there's been like 5-7 Muhammads in this chat already today. Muhammad Ali is 71% on free 120. Good. It is good. With MDMEs 26 to 31 in the same range. I said get your 3-digit scores. But yes, 71% is very solid. Ali H, Red Hot Chili Peppers shirt. The Simpson episode was dope with Chili Peppers. I have not seen Simpsons episode in Chili Peppers. I went to a Chili Peppers concert when I was 16. It's a fucking epic concert. See, I'm not a fucking wannabe. Like I've actually been to the Chili Peppers live. I need to get some Blink 182 gear. I listened to Blink 182 a lot in high school. That's what I'm gonna do. I'm gonna get some like Blink 182 gear. That's what I'm gonna do. I'm gonna write that on my phone. Actually, I'm gonna write in my fucking reminders. Blink 182. Blink 182 gear. Gear. There. I'm gonna buy some Blink 182 stuff. Maybe a hat. Maybe some shirts. I don't know. I'm gonna get some Blink 182 stuff. Blink 182 was my senior year of high school. I used to drive to school like blasting Blink 182. I already answered this question, Mohammed, about you asked about having a girlfriend in medical school. It's hard to be in study mode seriously for USMLE while you're trying to do the whole dating thing. But I mean, it's hard. It's real life, isn't it? It's hard. It's real life. It's like if you can somehow have if you're a beta who is like, and you have no dating like prowess, that can be an advantage if you're in medical school because you're just like you don't have that in like that drive to be like going out and meeting people and stuff. Um, Ahmed Abadi, while studying for Step 2 CK, which breaking up will fuck up your score? Kevin, thoughts on choosing family medicine as a specialty? I think FM's great. FM's great. I said if I had gone into practice, I would have done FM. Mohammed, what's your favorite TV show and movie? Someone fucking asked this yesterday. I said for movies, I like Fifth Element. That's like one of the most underrated movies of all time. Fifth Element. Fifth Element. I've said Born Identity, and Pulp Fiction. But I also like The Cable Guy with Jim Carrey. That's also a highly underrated movie. The Cable Guy, fucking amazing movie. It's a weird fucking movie, but it's like highly like it's one of the greatest movies of all time. I think The Cable Guy with Jim Carrey. Fifth Element. Fifth Element's incredible. I don't have favorite TV shows though. Like I don't watch TV. I said like on YouTube I'll like cycle through sports or something. I'll watch like different sports. Like right now I'm watching golf. No fucking idea why. It's not like golf specifically like intrigues me, but I'm watching golf right now. And then earlier this year I was watching a lot of basketball. Later I'll watch like football. Right? I cycle through sports. And then I watch some like political stuff occasionally. Ali H, the reason I asked about updated PDFs is because I wanted to make sure I don't miss when you add stuff. I had gone through cardio before, and good thing you said updated. You updated it, otherwise I miss it. No, it's true. It's just that, as I said, if I like right next to my, if I actually write out on my website when I last updated a PDF, it'll just induce a lot of whining. People will be like, oh, Mehlman's PDF was last updated only in January. Like, I'm not going to read that. Like, people will just whine. I don't want to deal with that. I already know it would entail DMs. It'll entail like all this stuff of like things I don't want to deal with. Beats by Bijou. Any tips for step 3? Yeah, it's a long fucking discussion. Do I really want to talk a shitload about step 3 right now? Like I could. You gotta do the 1900 questions in UWorld. For step 3, you got to do the CCS cases throughout your prep, maybe like 2-3 per evening. You don't have to do the UWorld CCS cases. There's like a ccscase.com that you can use. You're going to do all the CMS forms and all the step 2 CK and BMEs for step 3, this like literally. Okay, the same way for step 2, you're going to do those for step 3. It's a long discussion. I could talk about step 3 for like 20 minutes, but like, most people aren't step 3. Joy Rehab Kalo. The reason why I asked about rheumatic fever valvular disease because a family member developed rheumatic fever at age 12, was diagnosed and started treatment a bit late. A bit late, positive anti-streptolysin O, was put on penicillin for 2 years. He is 21 years old and is worrying he will develop valvular disease in his 30s and experienced heart problems back then, by the way. Well, I'd want to know if he had a murmur. If he doesn't have a murmur, if he doesn't, because like mitral stenosis it occurs later in life from generally scarred over mitral regurg. If he doesn't have a murmur now, then he likely won't go on to. It's less likely he will go on to develop some sort of valvular abnormality. It's less likely. Those things are usually subclinical. Like he could be perfectly fine and then no symptoms whatsoever, but he has a soft murmur and it's like shit, he actually does have a valvular issue. But it's a real thing, you know, it's a big fucking deal to have rheumatic heart disease. It's a big fucking deal, you know, to not treat with amoxicillin or penicillin. Abraham, if you suspect a patient, the fuck was I? Just lost where I was in the chat. If you suspect a patient have acute kidney injury, how can you manage without knowing baseline creatinine? Just load them with fluids until you can track electrolytes in urine, ? Starting nephro rotation tomorrow. I mean, what do you want from me? Like a fucking renal lecture on like, right? Is that what you want, Abraham? These office hours are awesome. There's a question on one of the NBME forms where they give you generalized hypertensive disease. Like they give you a patient with super high blood pressure and has hypertensive retinopathy with narrowing of the retinal arterioles on fundoscopy. And then they ask for like what you should do for kidney testing, which is like weird. And the answer is just check creatinine. They have other weird distractors like sodium to creatinine ratio, like weird answers. And the answer is just check creatinine. And apparently the reasoning is if a patient has hypertensive disease like retinopathy, then you want to check creatinine to see if there's hypertensive nephropathy. You want to see if there's renal damage occurring. It's assumed baseline creatinine is probably going to be 0.7 to 1.2 for like healthy patients, right? Once you've hit a creatinine of 2, you've lost 90% of your renal function. So, you know, in order for your creatinine to go up, to creep up 1.3, 1.4, you have to be like losing renal function. So people who are healthy are not going to have elevated creatinine. Creatinine can also be falsely elevated if you take creatine as a supplement. Or also if you do like intense exercise where creatine kinase goes up, that can give you a falsely elevated creatinine as well. People have like intense exercise. Like you don't check the CK specifically, like you're not getting a, you know, like you don't order the creatine kinase, but you order just the general panel with like creatinine. You're like, oh, the creatinine's high. What's that about? It's like, well, you were doing a lot of like, you know, strenuous lifting and stuff that can sometimes falsely elevate your creatinine. And you take creatine supplements that can falsely elevate your creatinine. Ashley Dawson, what's the difference between PAD versus PVD? Are you talking about like peripheral vascular disease versus pulmonary arterial disease? Claudication in one and not in the other? I'm confusing myself. Love the Red Hot Chili Peppers shirt, man. Best comment. Just got my results back this last week and passed. Thank you so much, bro. On 2 questions, I could hear you say wrong fucking answer while reading tricky choices. That's good. Guys, reading the live stream, please give the video a like. Waleed Ahmed says, will AI ever replace doctors? I've answered this. I've said, I think it'll replace surgeons eventually. It's a long discussion, but I think it'll replace surgeons for sure. AP Sans, what's up, bud? You're the M&M of USMLE. You don't look like any of the other popular tutors, but you're better than 99% of them. Med, whoa, wow, that's some great thing. AI is the next thing in evolution, ? Nassan, I want to have 6 kids. Only 6 kids? AP Sans, Adam, the MSPE helps. Apparently, it's like another personal statement, and some PDs look at MSP after step scores. Well, no fucking shit. Your step 2 CK score and your class rank matter. Abraham Tanosian. Uh, Mike, it's not mutual. Okay. Mike, it's not mutually exclusive. You can be a misogynist and vote for Hillary Clinton. Not saying you're misogynist. I disagree with that. No fucking misogynist would vote for Hillary Clinton. Give me a fucking break, bro. That's laughable. That's laughable. Like times like, I think that's probably one of the most laughable things. I think that possibly is the most laughable thing I've like seen slash read slash heard this year. You think there's some misogynist out there who like voted for Hillary over Trump? Please. Laughable. Laughable. That's a joke. You got to do better than that in terms of like, you know. AP Sans Mike, I'm trying to do 3 CMS per day. Too much. You got to do 2. You ask, you think this will hurt me over time? I said only 2 per day. Sunny, I feel as though I'm getting many difficult questions correct via process of elimination rather than being confident that the correct answer is this bad. Don't give a fuck. Because how you feel subjectively doesn't matter. As long as you're getting the correct answer, it's all we care about. People are going to feel like, that they're either not remembering things, or they're going to feel like, dubious or ambivalent about certain things in their study process while answering questions. It's sort of irrelevant. It's like, as long as you're answering the questions correct, do we really care like about how you feel that way? Ashraf Mahmoud, what do you think about Muse? Does their music inspire you? Never heard of them. Best comment, best place to visit in Japan. Um, well, I think Osaka's a great place to visit, which is where I am. Osaka's the best. I think Osaka. More recently, I mean, Osaka's changed post COVID. That's a long discussion, but like, I like Hokkaido as well, the northern island, the cold. I like going there in the winter. Mazrur, women are happy choosing nothing, and men are happy simping while getting nothing. Well, I mean, okay. I mean, yeah, I've talked about this. Many women will choose nothing. It is true. I don't want to. There's nothing to be like negative, and it's nothing. But there's a greater propensity now for women to, if they don't meet their 11 out of 10, Tom Brady, you know, CEO, multimillionaire model, perfect dude, they're not interested. That's like more and more occurring. That's more and more prevalent. Women will date a guy who's plain, who's more average, if he's within her social circle. When you see an attractive woman and she's with a guy who's not so attractive, there's no negative judgment. There's nothing negative. There's no judgment. It's about just men will ask about this observation sometimes. How it's possible, quote unquote. And when you see an attractive woman, she's with a guy whom you feel maybe isn't as attractive, without judgment, it tends to be he's within her social circle. They work at the same fucking office and they see each other all the time. He sits next to her in class in a PBL group discussion. They sit at the same table every fucking day. They twice a week, 3 times a week, they're at the same like group discussion. They have the same clinical coaching class together. They see each other all the fucking time. They work at the same cafe. He's a friend through the coworker's friend, best friend, whatever. There's a social circle tie there. But for girls who meet guys who are not in their social circle, some random fucking dude who opens them while they're like catching the bus, some random fucking dude who like opens her while she's like, on the train. Women, they can be open to it sometimes. But their bar is a lot higher in terms of they only care about appearance. That's my view. It's nothing negative. But women don't care about guys' personalities if they're outside the social circle. It's just appearance. So what happens is you say women will choose nothing. That's correct. A woman doesn't have to be dating anyone. She could be searching for a boyfriend or something, saying, I'm so lonely. I wish I had a boyfriend. You'll say hi to her. She'll reject you because you're not in her social circle. And she doesn't think of it that way, but she'll reject because, social circle is the number one thing they want. It's like searching for a product on Amazon. Any fucking product, anything. You want to get a fucking toaster, something stupid, okay? You want to get a fucking toaster, and you go on Amazon, and there's like a toaster that looks like average or something, but it's got fucking like 434 reviews and like 4.7 stars. And you're like, well, that toaster fucking works then. That works. That's called social circle. There's like trust in place. There might be a better looking fucking toaster. This one's fucking stainless steel with fucking like, different buttons and stuff and settings. It's a nicer looking toaster, but there's like 3 reviews or there's no reviews. So there's no trust in place. There's no social circle in place. That's how women are with guys a lot of the time. You can be an attractive male, but if she doesn't fucking know you and there's no social circle in place and you're just approaching her while she's catching the train, it's like it doesn't matter sometimes. Like most of the time people aren't going to like buy something on Amazon. It's like, they want to see the fucking reviews there. That's how it works. That's how women think when it comes to like, guys are more likely to just be like, okay, here's a random chick. I'm down. That's how guys are. Could talk about this for ages. Adrian Ionescu, what's your biggest advice for mediocre step 1? You passed, but want to crush step 2. Same idea of hitting QBank hard and then NVMe is correct. You're going to do QBank for 2 months, and then you're going to do CMS, all the CMS forms, NVMe 6 through 8, CMS again, free 120, 9 through 14. That's what you're going to do. Dylan Mookin, sorry. I think you skipped my question I asked for. I did not see your question, Dylan Mookin. You're correct. First fucking time I'm seeing your name right now. I asked for step 2 CK. Should you do the NVMe forms standard or self-paced? Standard for sure. And how many incorrects should you aim for? You want to get at least 2/3 correct on NVMEs. 70% plus is good. Mohammed, lost where I fucking was. Mohammed Hajjaj, is it doable to finish step 1 in 6 months? Way too long. 3 months for step 1, 2 months for QBank, 1 month for NVMEs. Guys, give the video a like if you're coming into the live stream. If you're not subscribed to my channel, subscribe to my channel. Some of you aren't subscribed and you're not going to subscribe. That I just said that. You're not going to subscribe anyway. I see the analytics. I know some of you watch this, you're not subscribed, and you're like, I'm not going to subscribe. Joshua Dale, why didn't you go into practice? No fucking interest. I've said that. Abraham Tanosian, Liar Liar is the best Jim Carrey movie. I don't like. I've heard of it, and I may have seen it. Um, I think The Cable Guy is the best movie Jim Carrey did. It was like brilliant. It was brilliant, brilliant. The bathroom scene in The Cable Guy, brilliant scene. King 17887. If you could be, what the fuck is this question? King 17887. If you could be any plant, what would you be? Like, how many plants can someone name? Um, I wouldn't want to be a plant. That's a weird fucking question, King 17887. Sonny, what do you think of the Denver Nuggets, especially how they won the playoffs on a clean sweep? No opinion on the Denver Nuggets. I don't like follow basketball that way. Like I said, I watched basketball earlier this year. Like I don't like follow teams like that. Like maybe the Celtics. Like I like because I went to school in Boston, but like I don't care about like who wins. Like I grew up, I went to lots of Yankees games. I grew up in New York, so I've been to a lot of Yankees games. Been to Red Sox games. I went to a Yankees Red Sox game in 2020. I sat first row behind the Yankees dugout. I was probably like literally like 2 meters away from Aaron Judge. It's one of those things, you know. It's like I was in Boston. I was like, I'm just gonna shell out a lot of money for this ticket. I was with a friend, but it's like I'm just gonna shell out a lot of money for tickets because it's fucking Yankees Red Sox, and you know it's a good game. It's a great fucking game. Um, for any Herschel Patel, for any specialty, do you think the average step two CK score for matched applicants will increase and step one is pass fail? Things are increasing in general. Like there's score inflations. Like things are increasing. Yes. Ashley Dawson. Yes. Peripheral vascular disease versus peripheral arterial disease. It's the same fucking thing. Like when you say peripheral vascular disease, it's not referring to venous. It's referring to arterial. So peripheral arterial disease, same thing. That's what I was asking. Like, what are you referring to? Like pulmonary versus peripheral? What were you referring to? Um, I mean, it's obviously very high yield for TCK. I mean, do you want like a lengthy discussion on that? I mean, you got to know ABIs are the first step in diagnosis for peripheral vascular disease. It's really, really important. Under zero point 0.9 diagnostic. And then you're going to go on to do an exercise stress test to determine exercise tolerance. If it's listed, if it's not listed, you go straight to the exercise program. Don't choose cilostazole as first line. It's wrong fucking answer. Don't choose arteriography as the next best step in diagnosis. Just do ABIs, then the exercise stress test to determine exercise tolerance, then do the exercise program. Recommend a walking program, prescribe a walking program, prescribe an exercise program. It's really, really, really high yield for TSK. It's pass level. It's a lot we can talk about. Like, I really don't want to talk about that. You know, I do teaching. Like I did 3 hours of teaching before I do these, you know, these Skype sessions. The fuck am I saying? I do 3 hours of Skype sessions usually before I do these live streams. Abraham Tanojian, think about all the internet dyslexic. Think about all the interest behind Clinton. You're telling me none of those business people are closeted misogynists? Correct. That's what I'm saying. That's what I'm saying. I don't think a misogynist votes for Hillary Clinton. You're like searching for like if you're new to this live stream, you don't know what I'm talking about. I've said briefly that like people will call me a misogynist or something. And I said, I fucking voted for Hillary Clinton. I voted for Obama. I voted for Biden. I voted for Hillary Clinton. I donated to Hillary Clinton. And I was saying, like, if I were a misogynist, don't you think I would have voted for Trump? Now, Abraham, you're saying, well, you're searching for reasons. Well, you could, they're not mutually exclusive. You could be a misogynist and vote for Hillary. Not fucking true. If you're a misogynist, you don't fucking vote for Hillary. You can have, and you say business interests. You can have certain business interests, quote unquote. When you get into that fucking voting booth, you're not fucking voting for Hillary Clinton if you're a misogynist. And by the way, if if you have business interests, don't you think that would be Republican, not fucking Democrat? People who are big business. But yes, I mean, she did some speeches or whatever, but it doesn't matter. It's Republican. If you're rich, you vote for Republican. Border, if you think you can assume things like, here we go. If you think you can assume things like misogyny based on who you vote for, whom you vote for. Sorry, but in the words of Mighty Melman, this is indeed laughable. Well, I think that opinion of yours is laughable. You can have your opinion. You can have your opinion. I mean, I have greater exposure to guys in like dating communities than you do. Like I have like, like I have a community with like a lot of, I'm the only fucking dude who like voted for Hillary. Every fucking dude I know voted for Trump. Right? It's like, as I said, when people get in the voting booth and like if they have a genuine hatred for women, you're not fucking voting for Hillary Clinton. Don't give me this like, people search for like these excuses, or you search for these loopholes. It's pretty like cut and dry. You can't really get more black and white than that. Like Trump appeals to fucking like dudes who want like an alpha figure, who need a fucking alpha figure to latch onto. You know? Like, I didn't need that. I thought and I think he's dangerous. He's a dangerous autocrat. That's what I think. So I don't agree with certain things on the left. I said I'm pro life. I'm pro life. I think feminism is like off the rails. I mean, I've still voted Democrat. I don't know about the next election though. It's divisive regardless. This type of talk, it's divisive. I mean, but as I said, I donated to Hillary, and I donated to Obama too. I donated a lot of money to Obama. Let's see. No, I have not seen that podcast. Best comment. Von Wilburn Disease. Stadium Arcadium is a great album. My favorite is Blood Sugar Sex Magic. Border says people talk empathy but don't seem to be able to put their own worldview away for 5 seconds to stand the view of somebody else. Waleed Ahmed. My wife and I are both attractive and are hoping to have kids soon. Is it possible for two attractive parents to have unattractive children? That's like an unusual thought. That's an unusual thought. I think it comes down to your level of judgment. I think that's what it comes down to. You have to be non-judgmental. Right? You can't come from a place of judgment. I've said I grew up with really negative voices about my appearance, and that was a huge insecurity of mine growing up. And I struggled with that when I was in my 20s. And I'm 36 and I'm better now. You know, I'm better now. But those things had to come to the surface. Um, but I mean that adversity, that macro adversity, that struggle has also made me extremely non-judgmental when it comes to others' appearances. And when you have one mindset, you see when other people very much don't have that mindset. I'm not in the cesspool of like people who are like highly fucking judgmental of appearances and all that stuff. So to me, it's like the world is full of those people, but it's not like it's not derogatory. It's just, it's not hard to fucking get on my fucking live stream here, right? And people just, they'll say negative comments about my appearance. That's how a lot of people are. They have their fucking negative judgments. So if you're asking this question about like you say you and your wife are attractive and you're asking about like is it possible for two attractive parents to have unattractive children? It's an unusual question. I think the more important question is like do you carry judgment about appearance where that would affect your love or your interest or your willingness to care for a child that you have? That's the more important question, which it shouldn't, right? I mean, it would be sad if it did, right? Because I dealt with a lot of that. Like when I grew up, I had a sister who was an older sister who was way more attractive than I. She was like very, attractive, and that was like the thing. All the, she was very, very popular, and uh, family always like gave her a lot of attention, and I struggled with appearance growing up. I was always like, the less attractive, you know, sibling. So, and I joke with her about that now. I joke with her about that because as we've gotten older, like I'm 36 and she's almost 40. She's still very attractive. There's no judgment. I mean, it's like I'm talking about my sister. Like, I mean, please. But it's like I joke with her about it because, I've had enhancements and stuff, and so I mean, like we joke about it. But I'm just like, look, you were more attractive growing up. It was a struggle dealing with it. And she's like, come on, you were like attractive, kind of thing. She's like, you were smarter, or you were the smart one. You were you were attractive. I'm like, nah. I was like, I was like, you were more attractive. You know, talk about those things, but you can't have judgment, right? That's the advantage. That's like I'm at this point. I'm 36. Like I feel, being non-judgmental of like people's appearances that way and how they relate to character. I think that's a positive thing. But that's just because I struggled with that my whole life. So if people criticize my appearance, it's not like I think they're bad people. I'm not like they're evil. I don't think of that. Like I empathize and understand. I have an EQ, a decent enough EQ, even if I come off like an autist. I have a decent enough EQ to know it comes from a place of like they maybe are in pain themselves, or they carry judgment themselves because they've always viewed life through the lens of judgment, because maybe they were judged and they haven't sorted out that process yet for themselves. You know, so an immature defense mechanism is just slandering other people because you don't know how to cope with those emotions yourself. So you just besmirch other people. You try to tear down other people because you don't know how to cope with those emotions in a mature way. That's really funny. Border, dude, these PBL relationships are real. That's hilarious. That's so funny. It's true, though. It's true. It's social circle. That's what it is, man. It's social circle. you know. Von Willebrand disease. Do you like mobster movies? Good, yeah, dude. Goodfellas. I was about to say Goodfellas is fucking good. You said you've been addicted to those lately. Goodfellas was, yeah, Goodfellas is top notch. Scarface also top notch. Goodfellas, I think, is the best one though. If I had to choose, I would say Goodfellas. Godfather never like specifically appealed to me. Like I know that that's probably like the most famous one of all time. I mean, I've seen it, but it's not like that one never specifically grabbed me. It was like I think Goodfellas is very, very easy to watch, and the characters are just executed fucking perfectly. I'd say Goodfellas is the best. Scarface is really good, but Scarface, I think Scarface is a little bit like how things are just like definitely like it's definitely like a bad ending for all of the characters involved in Scarface. um I don't know, I just like I don't like how that ended necessarily. Scarface, I think, Goodfellas, I think, is just generally an easier watch. Goodfellas, yeah, it's good. Let's see. Darshil Patel, you got 4 weeks left for step 2 CK. You did first pass at UWorld during your rotations, but some rotations been a while. I do have rotations currently. Should I just focus most of my time on the CMS forms? Yeah, I mean, for each of your rotations, you have 4 weeks left. Um, I mean, if you have 4 weeks left until your CK, you got to make sure you go through MBME 6 through 14. You got to get through all that. And yes, you got to do the CMS forms. But 6 through 14, make sure you finish all those forms. Sonny, not sure about how familiar you are with the West Coast, but do you have any thoughts on West Coast versus East Coast social culture regarding friendship and dating? Not in terms of friendship and dating, not really, because I don't live in the United States. Like I have friends who are like Florida. I have a lot of friends in the U.S., New York, California. I do have friends on both coasts. My general impression is the West Coast is way more like laid back. I'm an East Coast personality for sure. Like I would be way more likely to live in New York. Um, I mean, like, I think in general, like with how I like with things I hear from many of my friends who live in the United States in different locations, dating has become more difficult. Like the energy that has to go in order for them to like get results they're looking for in terms of just women not ghosting them and stuff, that has like become more difficult in the United States. But it's not unique to the United States. It's like to many places. Rayhan, you say a lot of stuff doesn't bother you. How did you get emotionally strong? I already answered this in the chat like quite a bit. I answered this today. Mazur, do you think war male scarcity is necessary for appropriate gender dynamics, especially to keep female hypergamy in check? I do, but I think that that's like you know, that's a difficult topic. That's a whole that line of discussion will induce triggerings. There's no free speech in 2023 when it comes to male female gender dynamics. There isn't free speech. So the second part of your question, the female hypergamy aspect, I do see it as off the rails. Digitization has done that. As I said, if the male is outside of the female social circle, if she's not gonna like actually, she might hook up with the dude, but to actually like keep seeing the dude and not ghost, he's got to be like significantly above her. That's the direction we're going. Like women, they'll pretty much only want to like be content with a guy who's like at least 2 to 4 tiers above them if they're outside social circle. But if he's within social circle, she'll date a guy who's below her. It's a dichotomy. So hypergamy is drastically increased in the threshold. The threshold is drastically increased outside of social circle. The way that males who don't bear the most superlative hypergamous traits, they have to be within social circle. Maria, pretty sure these ideologies. I'm a misogynist. Well, look, I mean, I don't know if you're still here. Some people dip in and out, but I mean, um, for a male to in 2023, for a male to simply voice that he finds it attractive for a woman to not care about career and to just focus on like pumping out kids and cook and clean, that comes off as like a parody and like misogynist, right? That's like not good. That's like, what do you mean? That's not like, you can't say that. Well, people can do whatever they want to do. I'm not saying what people have to do. I have like, I have like a guy friend, anecdotally, I have a guy friend who he wants a fucking chick who's got like a PhD and all this stuff. I'm like, why? I like joke with him about it. I'm like, that's like literally the opposite of what I'd want. Like if I meet some chick and she's like, I have a PhD in like molecular, you know, photosynthetic, like, metallurgic animal, I'd be like, I have no interest in this. Like I'd rather date a chick who works at a convenience store. That's my view. It's okay. Focus on career. There's nothing wrong with that. It's because I see career focus in women as inversely correlated with maternal proclivity. And it's the maternal proclivity that I view as most attractive in a female. So if a female is more likely to pursue some career, then she's less likely to focus on kids. And I see that as, less attractive. But there's nothing wrong with that. People can do what they want to do. There's nothing wrong with that. People have different views. Agent Fresh, why do they hate Hillary? I said I voted for Hillary, but people, I don't think I know a single person who liked Hillary. I liked Hillary. I mean, what was wrong with Hillary? I thought she was extremely qualified. I thought she was like the most qualified candidate we ever had. I'm like the only person I know who liked Hillary. Everyone I talked to like didn't like Hillary. I don't think I had any friends who voted for Hillary. I think I had like, I had some family members who like reluctantly, I'm like, voted for Hillary, but like I donated to Hillary. Abraham, we should let all the misogynists know that one way they can erase that label is by simply voting in an election they have. You're like very up on this. You're very up on this. You're like really like you got like some strong intrigue. I just think it's interesting. I think it's interesting. Like you're insinuating that somehow I'm a closet misogynist, that I voted. You're trying to insinuate that I voted for it, that despite voting for Hillary and donating to her, that I'm using that as like a proxy. I'm using that as a pretext for being able to be a closet sod as though I'm not. That's your insinuation. Because you made like 6 comments about it. You're like really trying to like Drill that. I think it's a poor argument. I'm not saying you can't, you're talking about over extrapolation or something, to other candidates regarding like, but I think it's pretty cut and dry. You know, Hillary versus Trump, please. Like if you're an actual misogynist, you don't go into that voting booth and vote for Hillary. That's not what happens. Trump was pretty much like it's not like it was Hillary versus like Ted Cruz. Okay? It wasn't Hillary versus like, Jeb Bush. It was Hillary versus Trump. So it's like it was pretty cut and dry in terms of like Dan Blauman, what do you say to men who paradoxically get more whiny and more needy because of repeated rejection, not enough rejections lost? I think yes, I think it's that's a DNA element as well. I've said it, there's a DNA element. Some men just whine. It's the most inferior male trait. Complaining and whining is the number one inferior male trait, and not being able to handle rejection. You have to hit a threshold. Um, it's like working out. Okay, you can't go to like Zumba class once a week and expect to like see results in terms of like your physique. You got to go consistently to the gym and have actual workouts. So guys who like say hi to one girl and they get rejected and they're like butthurt, like you have to pretty much do it like high volume, where you like go to the station or something and you like go out of your way to say hi to like 50 girls. That'll trigger some people, but I'm answering your question here as far as like you have to have a threshold. You don't go to the gym and you lift like a dumbbell like for half a set. You go to the gym and you do like, different sets, different like you have a threshold you have to hit and you see results. Well, you have to go out and open like 70 girls maybe in like 2 hours. That's not even a lot. And then you're going to feel differences in your personality. You're going to be like more resilient. That can't be faked. I mean, I said for years that the amount of rejection the male takes is directly proportional to his macro confidence and acute reduction in his non neediness. And that the more rejection a male takes, the more masculinized his behavior. There's a direct relation between like how feminine a dude comes off and like his lack of interaction with women. Things I say, there's like trigger points, like, for people. Dan Blauman was approaching the only way in which you became unemotional. You sell merch, bro. I had like wrong fucking answer t-shirts and stuff. I did. I talked about this, how like I had a Shopify open, but I closed it because it was impractical. Like you can't make profits off of that. You can't make profits off of Shopify. You want like t-shirts that are like $20 that people are willing to buy. Well, you basically have to pay to keep the store open. It's like laughable, like you have to make a t-shirt like $40 in order to um, get any profit. And it's like $4. Abraham, would you recommend someone to get into IM only taking into account pros versus cons of the specialty, nothing else? Um, I'm not sure what you're asking. Let's see. I lost where I was. Dylan, for step two CK, do you think good scores on the offline NBME 6 through 8 are still important? Yeah, I mean, like, you obviously want to do as well as you can on the NBMEs, but the CMS forms, you're going to be doing those after NBMEs 6 through 8 anyway. So, like, even if you do shitty on 6 through 8, like, you're going to go on to do um, the CMS forms again, the second pass, and then you're going to go on to do free 120 and 9 through 14. So, your scores, they're going to be higher when you eventually hit 9 through 14 because you've done that second pass, the CMS forms. I do care what people get on 6 through 8, but I just said, like, I don't care if I don't worry about like what they get on 6 through 8. I don't worry about it because if they get like their 220 and they're upset, I don't care because they say, look, you're going to do another pass of all the CMS forms anyway. Dylan Mookin, essentially, I'm asking, do you think as new forms are released, the old forms are less important? Not really. No. Like, no, I think the old forms are important. I think what changes is like how many forms I might have a student do. Um, when I'm talking about like the actual like which forms I'll have a student do. When I talk about NBMEs, like for example, if they release NBMEs like 32 through 35 or 32 through 36, like I'm not going to have people do like 20 to 36. I'll make it where it's like, okay, well now we're doing like 25 through 36 or something, or 26 through 36, that type of thing. They're not less important. It's just you don't need to go through like countless forms. Mountain Dew studying. I'm subscribed. If I have very, very low UWorld scores, is like, am I likely to get 250 plus in CK? Well, you got to see how you do on the NBMEs when you finish UWorld, and then you got to go through all the clinical master series forms twice. Um, Ahmed, I'm not familiar with that. Sunny, thoughts on myo reps? It's when you do 20 reps at a very low weight, take a few deep breaths, and push 5 reps more, and then you take a few more deep breaths. I haven't done that. I tend to just lift like heavyweight. Sharik, hello, Mike. Love your videos. The Iron Throne. Since medicine takes a huge part of our thinking, do you think dating a girl outside medicine would work? I think I would prefer that. Like I wouldn't. I ideally like you need like an outlet. You say, I mean, what if you want to talk to her about what's going on with work and patients and not what? It depends on what you want to do. Some people like it's like they meet someone who's a doctor at the social circle, right? Like someone who's in medicine. It's not a crisis, but like I tend to think of like dating as an outlet. Um, Carson, the Iron Throne. What do you think of Bernie Sanders' ideas? I mean, I don't really care. Like I didn't specifically like latch on to Bernie Sanders. I was pro Hillary like during the campaigns and stuff. Ahmed Hendy, hello, Dr. Mike. Good to see you. What's up, Ahmed? Rayhan, what are your tenets in terms of how a man should be? Give me 5. What is this, Chat GPT? Nokia, good to see you back. Your students that work full time, have you found that there is a change in time frame to sit, like 4 to 5 months for step one instead of 3? Um, well, the thing is, I just want to see you get through. You're asking about step one. I just want to see you objectively get through all of UWorld or Ambos, and I want to see you get through all the NBMEs, 20 through 24, free 120, 25 to 31. I want to see you get through all of that. It can't be too protracted. Like you need to get through that. So people work full time. I mean, obviously not ideal. David Pulatov. Dr. Mike, stand and deliver. Dr. Mike, although one-on-one tutoring with you would focus more on my weaknesses, I wish you had a small 5 to 10 group of students to split the cost with them. Thank you for everything you do. Well, I don't know what to fucking say. Find 5 to 10 students who might want to do that, but it's not greater than 99% of what I do is one-on-one. You're just paying for time. That's what you're paying for. So if you wanted to like split it with like, your friend or your partner or whatever you're doing, which sometimes I've done 2-on-1 that way, but like, if it's the value, high value is custom catering as well to your schedule and your plan. When I work with couples, it tends to be where like I literally Skype the fucking like dude, and then like half an hour later I Skype the fucking girlfriend or something. Like that's literally like how it is. Dylan, so if I'm already doing well on step 2 CK and BME form 6 through 8, I shouldn't be worried about doing worse. Why would you do worse on 9 through 14, even though they're newer forms? Because Dylan, you're going to do all the CMS forms like a second time between now. When you finish on BME 8, you're going to do literally 3 to 3.5 weeks of all the CMS forms, 45 to 50 forms, before you do 9 through 14. So your scores are going to be higher on 9 through 14. Hassam Hanafi, I'm 33. Is it possible to take step 1 and step 2, or is it too late? Why would it be too late? I've had students who are like in their 50s. I've literally Skyped like students who are like my mom's age. Well, my mom's like in her 60s, but I mean, I've had students like in their 50s. Do you think GLP-1, and it's like weird sometimes, if I'm like telling them you're fucking wrong kind of thing, and they're like significantly older than I am, it's like, so I don't change my personality for like anyone. So it's like, do you think GLP-1 agonists and other treatments like intragastric balloon will make bariatric surgery defunct? It's like the latest fad. It's just an offshoot of like Americans, mostly like Western countries, people just not wanting to work out. But I mean, bariatric surgery is known as being definitive. I don't know about defunct. I stay within my lane. Am I like a bariatric surgeon? Am I, an endocrine, a gastroenterologist slash endocrine specialist? No. David Pulatov. I've said I just do USMLE stuff. Hello, Dr. Mike. I took step 1 2 weeks ago. I got around 60 to 64 on my NBME. Due to time frame, I had to take my step 1 in a certain time period. What do you think are my chances of passing? 60 to 64s on NBMEs are not sufficient. Hopefully you passed. Am I here to set you off? Like when the horse has already left the gate or whatever, or the stables, however the fuck you want, whatever expression you want to use. I mean, you've already taken the step 1. So what benefit is it for me to say your scores are too low? Right? Is that going to help you at this point? No, it's just going to set you off. But for other people here, if you're getting like 60 to 64% NBMEs, I wouldn't recommend sitting USMLE. Like you have to get 3-digit score conversions, and you have to get 205, 210 plus. That's what I'd want to see. So the newer, Dylan, you say, so the newer step 2 NBMEs, forms 9 to 14, don't have new content that weren't tested on form 6 to 8? Of course they do. But it's just saying that you ask if they're harder, quote unquote. right? That's what you're asking, Dylan. Why are we worrying about 9 through 14? Just like you sat 6 through 8, and then just see how you go through all the CMS forms again, and then see how you go on 9 through 14. Every NBME is going to have like left field questions. You can't prevent that. L33, you have a fantastic morning today, Superhero Mike. Skate somewhere for me when you need to and have that. I'm going to skate after this, actually. I'm going to go out. I'm going to get some breakfast. I'm going to skate. It's 7 a.m. here. Awakened by Ya. Dr. Mellon, thank you for the audio question, Vig. It is marvelous. Yeah, I mean, I put out daily questions, right? In your daily. Guys, so it's been 2.5 hours. All right. So obviously, I'm going to do more of these live streams. All right, guys. Rayhan, hurry with your question right now. Seriously, hurry with your question. You're hurrying. You're like, I got to get these comments out like ASAP. You're right. It's good. Otherwise, I'm going to leave. Before you go, I want to ask something. I tend to do 5 to 6 blocks and then review in the next 2 days. All right. So guys, I'm gonna head. I'm gonna get some breakfast and stuff. All right. Obviously, I'm gonna do more of these live streams. See you later, guys.